Heart.
Heart.
Right. Okay, so like this? No, it's like this.
Okay,
right?
yeah, it's like, no, that's not what it is, yeah. Okay.
Yeah, so apex always points down to the left,
Right.
between the second and fifth rib about. So there's four main chambers. This bottom here, this bottom half, you have the right and the left ventricles. Then you have the right and the left atria. You can see the atria a little better on the back.
Oh, yeah, okay.
So that's the right atria, left atria. And these little flaps up top, these are the auricles.
That's right.
Yeah, they look like ears, kind of, especially that one. So blood comes into that right atrium through the inferior vena cava and the superior vena cava. So that's the inferior vena cava coming up. Superior vena cava is really short and it branches off into those brachiocephalic veins.
Okay.
So that's what this little branch is. Yeah, so blood gets pumped in there, goes into the right ventricle. Okay, that muscle contracts, pumps the blood through this pulmonary artery, or this is actually the pulmonary trunk, that first main portion that splits off into the pulmonary arteries.
Okay.
So here's one pulmonary artery going to the left lung, there's the other pulmonary artery going to the right lung. Gets oxygenated in the lungs, comes back through the pulmonary veins, because remember veins go in.
Right.
They have the I-N in vein. So
Yeah, that's right.
veins go into the left atrium, right? Falls down through which valve? The mitral or bicuspid valve?
Bicuspid, yeah, that's easier.
Yeah, bicuspid valve into the left ventricle, which is more muscular, and when that muscle contracts, it pumps it up the aorta. So this as a whole is the aorta, but it's broken up into the ascending limb, because it's going up, the aortic arch, and then descending limb. And then you have these little branches at the top. This one is the right brachiocephalic vein. This is the left common carotid artery, and this is the left subclavian. So over here, that's the common carotid, which goes up, and that's the left subclavian. So on the left side, you just have those two coming out of the aortic arch. On the right side, it comes up into this brachiocephalic trunk, and then splits off into the right carotid and right subclavian. So it's kind of different on each side.
The two rights and the left.
Yeah. Let's take this off. Okay. So up here you have the sinoatrial node. It's called that because there's the sinus for the superior vena cava. It's an atrium, sinoatrial node. This one is the atrioventricular node. So it's kind of between the atrium and the ventricle. So this node is known as the pacemaker because it starts the first pulse. And it's just based on blood flow through the inferior and superior vena cavas. And then the atrioventricular node fires second, so it's like the love dove of the heartbeat.
Oh, that's right.
Yeah. Okay, yeah, so it's the right atrium. This is the tricuspid valve, which is that valve that comes into and enters the right ventricle. This wall right there, what's that called? Interventricular septum. Yeah. It just separates the ventricles. What are these strings called that come down from
The heart strings, I can't remember what they're called.
Chordae tendineae.
Chordae
Tendineae. Yeah. And they connect the valve to these papillary muscles, which, see number 2 right there? Just little muscular extensions inside the ventricle. Yeah, and then you have all those little matrix-like network of muscles on the wall. Yeah, those are called the trabeculae carneae. Okay. And then your pulmonary trunk and aorta have valves too. So this is the pulmonary aortic semilunar valve, and then the aortic semilunar valve. Yeah. And then that was the bicuspid or mitral valve. There's also veins that come around the outside of the heart. These can be a little tricky. But first, this is the atrioventricular groove, which is that groove around between the atria and the ventricles. And then you have this interventricular groove, or sulcus, however you want to say. You have the coronary arteries, the artery that feeds the heart tissue, the pericardium. And then you have the cardiac veins, which return to the right atrium through that coronary sinus. So that's the orifice of the coronary sinus is what it's called. So this is the coronary sinus.
That's right. That.
Yeah, and that just enters into that right atrium. Okay, this is the right coronary artery. Okay, right coronary artery. Left coronary artery. This is the circumflex branch of the left coronary artery. Circum means it's coming around.
Okay. It's kind of like the leg one too.
Right. This is the the anterior interventricular branch.
Which one?
This one.
Okay.
Of the artery, right?
Yeah, the
Okay.
artery. Yeah. This is the posterior. This guy. That's the posterior interventricular branch
Okay.
of the coronary. This is known as the marginal branch.
Okay.
All right, and that includes this too, marginal branch. And this is the. What is that one? I'm not sure what that's called. We have to look it up.
Do you have to know it?
I think so.
The
Okay.
coronary artery.
No, we already.
Yeah. So the right and left
Yeah,
coronary
and
arteries.
then
Could be
cardiac
veins.
veins.
Cardiac veins, yeah. So you have the great cardiac vein, which is this one that goes down that interventricular septum.
Mm-hmm.
Wait, but it's red.
It's it's blue.
The vein goes down the. Oh, so it's this. It's not.
Yeah, the blue.
Oh, it's not the red. Okay. Okay.
Yeah. The red's that anterior
Okay.
interventricular.
Okay. So it's not the one on either side. It's just that one, or is it?
It's just all this as a whole.
Okay, so it kind of split.
You don't have to know the names of these specific branches, but these main ones coming down that
Okay.
interventricular groove.
Those are the.
That's the great cardiac vein.
Okay.
Yeah. Then you have there's a great cardiac vein. There's a anterior, posterior,
Or middle.
middle, and small. Okay. Yeah, I'm a little confused on these right now. It's been a while. Yeah, I can't tell you without looking it up, so I have to look it up. But you're